Imagine that annoying, burning sensation in your nose. You're breathing in, and it feels like someone rubbed sandpaper across your sinuses. This discomfort can strike when you least expect it, during allergy season, on a dry winter day, or right when you're recovering from a cold. If you're dealing with a fiery feeling in your nose, you're not alone, and it's not just you. So, what's really going on? Let's explore the underlying causes of that burning sensation in your nose, what it could mean, and most importantly, how you can feel relief. What causes a burning nose? First, it's important to understand that a burning nose is usually a sign of some kind of irritation or inflammation inside your nasal passages. Your nose has one main job: to filter, humidify, and warm the air you breathe. When it's irritated, though, it may feel like it's burning, stinging, or itching. Here are some of the most common reasons why. 1. Respiratory infections, colds, the flu, and even COVID-19 can all cause nasal irritation. As your immune system battles these infections, it sends more blood to the nose, which can lead to inflammation and that familiar burning feeling. Colds and flu. If you've got a cold or the flu, you probably know the drill: stuffy nose, sneezing, sore throat, and that burning sensation. These symptoms usually go away on their own, but over-the-counter decongestants can offer relief. COVID-19, this virus also affects the respiratory tract and may cause a burning nose, among other symptoms. If you think you have COVID-19, make sure you follow up with testing and isolate yourself from others to prevent spreading it. 2. Allergic rhinitis. For those of you who have hay fever, that annoying, burning nose might seem like a springtime, or even year-round, ritual. Allergic rhinitis occurs when your immune system mistakenly thinks a harmless substance, like pollen, is a dangerous invader. It responds by releasing chemicals that cause inflammation in your nose. Hay fever, seasonal allergies. When allergens like pollen are floating around, the body's immune system goes on high alert. Hay fever affects around 10–30% of people worldwide. If you suffer from this, avoiding outdoor activities during high pollen days and using OTC antihistamines can help you find relief. Perennial allergies. These are triggered by allergens like pet dander, mold, or dust mites and can affect you year-round. Treatment includes avoiding allergens, using nasal sprays, and possibly considering allergy shots or immunotherapy. 3. Non-allergic rhinitis. Not all rhinitis is caused by allergies. Non-allergic rhinitis can cause the same uncomfortable symptoms but tends to be triggered by things like air pollution, changes in weather, or even strong smells. Symptoms and triggers. Non-allergic rhinitis leads to sneezing, a runny or stuffy nose, and a burning sensation. The causes can be harder to pin down. Anything from cigarette smoke to perfume might trigger your symptoms. Treatment. Try using saline sprays to rinse away irritants or medicated sprays to reduce inflammation. 4. Sinusitis. Sinusitis, or inflammation of the sinuses, can develop due to viral or bacterial infections. When your sinuses are inflamed, the whole area around your nose, cheeks, and forehead can feel sore or tender. Viral sinusitis. This often goes away on its own and doesn't require treatment. Bacterial sinusitis. For bacterial cases, antibiotics may be necessary. Rest, warm compresses, and nasal rinses can help relieve some of the discomfort. Symptoms that accompany a burning nose. A burning nose often doesn't come alone. You might also experience symptoms such as itchy, watery eyes, common with allergies, especially allergic rhinitis. Sore throat, often accompanies colds, the flu, and sinus infections. Congestion and runny nose. This is your body's way of trying to flush out irritants or invaders. Sneezing and post-nasal drip. These symptoms may also point to rhinitis or a sinus infection. Depending on the cause, symptoms can vary widely, so it's essential to note any additional signs. For instance, if you're experiencing body aches and fever along with a burning nose, you may be dealing with a flu or another viral infection. Home remedies for a burning nose. While a burning nose can be uncomfortable, there are several home remedies you can try that might help ease the discomfort. 1. Steam inhalation. Inhaling steam can help clear congestion and relieve inflammation in your nose and sinuses. Simply fill a bowl with hot water, cover your head with a towel, and breathe deeply for a few minutes. 2. Stay hydrated. Drinking plenty of fluids helps keep your nasal passages moist, which can reduce irritation. Warm fluids like herbal teas, soup, or even just warm water can be especially soothing. 3. Humidifiers. Adding moisture to the air in your home can help reduce nasal irritation, especially during dry winter months. Just make sure to clean your humidifier regularly to avoid mold and bacteria buildup. 4. Saline nasal spray. These sprays help flush out irritants, such as pollen or dust, and can moisten your nasal passages, helping to relieve burning and discomfort. 5. Lubricating nasal gels. Over-the-counter products like saline gels or petroleum jelly can keep your nasal passages moisturized. These gels form a protective barrier and can soothe any irritation caused by dryness or inflammation. When to seek medical care? Most of the time, a burning nose is simply an annoyance. However, if you experience sudden or severe symptoms, it's important to seek medical help. For instance, if you experience symptoms like severe headache or sudden weakness, these could indicate a more serious condition, such as a stroke, which requires immediate medical attention. High fever or persistent symptoms. If your symptoms persist for more than 10 days or are accompanied by a high fever, consult a healthcare provider. COVID-19 symptoms. If you suspect you have COVID-19, follow the CDC's guidelines for testing and isolating. Preventive tips for avoiding a burning nose. Here are a few tips to help you avoid future nasal irritation. Avoid known triggers. If you know pollen, dust, or pet dander sets off your symptoms, try to minimize your exposure. Wear a mask. If you're going to be around irritants like dust or smoke, wearing a mask can help filter out some of these particles. Wash your hands frequently. Reducing your risk of respiratory infections, including COVID-19, is as simple as practicing good hygiene. Monitor pollen levels. Apps and websites provide pollen forecasts so you can plan your outdoor activities around days with lower pollen counts. Clean and ventilate your home. Regularly dust and vacuum, and open windows whenever possible to help ventilate your living space. Final thoughts. Dealing with a burning nose can be frustrating, but knowing the root causes and solutions can empower you to take control of your symptoms. Whether it's caused by an allergy, a respiratory infection, or environmental irritants, a few simple changes and remedies can make a big difference. Remember, if symptoms persist or worsen, it's always wise to reach out to a healthcare provider. With the right tools and knowledge, you can keep that burning feeling at bay and breathe easy again. So, next time your nose feels like it's on fire, remember, there are steps you can take to find relief and keep your nose happy and healthy.